Hey guys, what's up? Welcome back to the channel. If you're new, my name is Vanessa. I'm a registered nurse, a licensed medical esthetician, and a certified makeup artist. So today's video is going to be all about anti-aging. So I'm going to be talking about what causes the signs of aging other than just age, and then also like some tips to avoid it or prevent it or prolong it. That was my dog, so sorry. And then also I'm going to give you guys some product recommendations and a skincare routine to go off of at the end of the video. Of course, I'll have everything linked down below. I'll link some studies to back up some of the stuff that I'm saying in case you guys want to do your own research, which is something that I always recommend. Okay, so let's just jump right in. If you see me looking down, I have some notes here just so I don't skip over anything. The first thing I want to talk about is what happens when we age and when we see those signs of aging on our skin. So the number one thing that comes to mind, of course, is decrease in collagen and elastin. So collagen is like the structure that keeps your skin firm and plump and holds everything where it needs to be. Elastin is, like the name sounds, it's how elastic your skin is. So as you age, you'll probably notice that if you like pinch your skin, especially on your face, if it stays like that and takes a minute to go down, kind of like memory foam, that probably means that you're lacking a little bit in elastin. If you do have a good amount of elastin in your skin, you can pinch the skin and it pops right back. So that's just a little test you can do. It can also mean that you're dehydrated if your skin stays tinted up like that, but that's another conversation. So when we have a decrease in collagen and elastin, the skin starts to sag, we get some wrinkles, everything starts to move down a little bit. So then the next thing, as we age, we have a decrease in our natural moisturizing factors. This is something that I talked about in my last video, which there's probably going to be a lot of overlap between this video and my dry skin video, because as we age, our skin tends to get a little bit drier. So the natural moisturizing factor is made up of things like amino acids, urea, sodium PCA, and these are things that keep your skin hydrated and plump. So as we age, these start to decrease, especially after menopause, as your estrogen decreases. So when we're looking for skincare, we want to look for things that have these ingredients to kind of replace what our skin isn't producing. Another thing that happens is bone resorption, and this is why if you look at a picture of somebody back when they were 20 versus them when they're 80, their whole face structure can look a lot different, and that's not just due to skin changes. A lot of that is also due to bone resorption. So as we age, and again after menopause if you're a female, your bones start to kind of resorb and break down, and when that happens, it changes, number one, how your facial structure looks, but also how your skin lays on top of that bone. So that can definitely play a big role in the signs of aging. Another really big one is pigmentation. So these are going to be things like sunspots or age spots, some people might call them, but this is just the little spots of discoloration on your skin, usually due to the sun. You can also have melasma, which is a whole different beast. That's more to do with hormones and happens a lot with pregnancy or just changes in hormones, but that one isn't really age related, but still in the same kind of family. And then you can also have enlarged pores as you age, and this is one that I think a lot of people don't really think about. You're more focused on the, wrinkles and that kind of thing. But as we age, as I said, you lose that collagen and elastin, and so you lose the support for your skin. So your skin becomes a little bit more stretched out, and that can cause the pore to be a little bit larger. And this can lead to clogged pores too, which you wouldn't really think of as an aging problem. You think, clogged pores, you want to think like teenager or like early 20s, but it can definitely happen to the aging population too. So that's just something to be aware of. So as far as tips go for trying to prevent or correct signs of aging on your skin, the first few ones are going to be very generic tips that you've heard 100 times and you're probably so sick of hearing, but I would be doing you guys a disservice if I didn't mention it, because they are some of the most important things. So number one, SPF, SPF, SPF. Every single day, whether it's rainy, cloudy, the UV's low, doesn't matter. Put on your SPF every day in the morning, especially on your face, neck, and chest if it's exposed. But if you're going to be out in the sun, in the water, make sure, of course, you're doing your body too. And you want to be reapplying this every 2 hours. So I know that can be a little bit difficult, like during the week when you wear makeup and stuff. So honestly, I'm not as worried about it there. Especially, I think that the iron oxides in makeup provide protection from the sun too. So I'm not as worried about you reapplying it to your face throughout the day, but definitely if you're going to be at the beach, at the pool, anything like that, make sure that you're reapplying. The UV rays from the sun can really damage your collagen and elastin and accelerate that aging process a lot. So if you're doing all of these other things that I'm saying, but you're not wearing SPF on a daily basis, you're really wasting your time and money because you're not going to be able to keep up with that damage that the UV rays are doing. The next thing is to drink a ton of water, keep your body really hydrated in a state where it can replenish the skin's hydration, because your skin is the largest organ of the body, but there's also a lot of other vital organs that your body's going to push that water to first before it gets to your skin. So make sure that you're staying super hydrated, because your skin's going to be one of the last organs to get that water. So if you're dehydrated, you're really going to see it on your skin. And then of course, eat lots of fruits and vegetables. A lot of the things that we apply topically on our skin are things that we should be getting in our diet from things like vegetables, fruits, proteins, that kind of thing. And so if you're getting things like antioxidants and amino acids internally and externally, then you're going to see a lot more benefits than just applying them topically. Another thing you can do for hydration is to sleep with a humidifier by your bed at night. This is another thing that I mentioned in my dry skin video, but if you put humectants on your skin, which help hold water into the skin, and then you sleep with a humidifier, your skin's going to soak up all of that moisture and you're going to wake up with a lot more plump, hydrated skin. And not to mention, your skin's going to be able to work more efficiently and kind of replenish itself at night. Another thing is to be consistent with your skincare. As you age, your skin cell turnover decreases a lot, and regardless of that, also it just takes a while sometimes to see the effects of skincare on your skin. So I recommend giving products a good 6 weeks before you decide whether you like them or not. And you want to be using the same products over and over again. You don't want to be bringing in new products every single day and trying new things out, because you're not going to know if you have an allergic reaction to something. You don't know what's causing it, and then also you're not giving the skincare products a good chance to actually work. So make sure that you're giving enough time in between trying new products and stuff like that. Another tip is, if you're really concerned about anti-aging and wanting to prevent or treat these things, then I would say get medical aesthetic treatments on top of using good skincare and doing all these other things that I'm saying. So this can be microneedling, Botox, fillers, Sculptra, lasers. There are so many different things that you can do. I can make a whole separate video talking about all of these and their benefits and pros and cons and all that kind of stuff. But they really pair nicely with a good skincare routine, and you're going to see more dramatic results, I think, than just using skincare. Another one that is so hard, but it's a good tip, is to try to sleep on your back. If you are a side sleeper or a stomach sleeper, I feel you, because I am too. And I've been trying recently to sleep more on my back, and I've been failing. But this is going to help a lot, because if you're laying on your side and your face is squished up on your pillow, your skin is being wrinkled. And over time, that's going to break down those collagen fibers and lead to wrinkles on the face. It also breaks down the fat pads under your skin a lot quicker, and it can make your face asymmetric if you're sleeping on one side more than the other. So it's just good to sleep on your back. I know there's pillows that kind of force you to sleep on your back. I haven't tried those yet, but I probably will in the future if I can't master it on my own. Other good tips are to exercise and get good sleep. You've heard these both 100 times, but sleep and exercise really do play a huge role in just the overall health of your body, but it also can show up a lot on the skin too. So that's super important. Something else that you can do is red light therapy. This is one of those things that it sounds like it wouldn't work, and a lot of people are super skeptical, but there's a ton of studies, and it's actually a treatment that's been done for years and years and years in the medical field, and it's been used for a ton of different things. But red light therapy helps to promote collagen production, so it helps a lot with anti-aging. It also helps with wound healing. So you can go somewhere and get red light therapy done, like at a dermatologist office or a medical spa, but you really want to be using it, 4 or 5 days out of the week, I would say, if you want to see drastic results. So there's at-home therapy devices that you can use. They're pretty expensive, but I would say that they're worth it if you're really serious about anti-aging. And then I know at a lot of gyms too, they have like the full body. It's almost like a tanning bed, but it's red light therapy that you can go stand in. So if you go to the gym, 4 or 5 times a week, just hit that before or after your workout and you should be good to go. Another one is that when you're applying your skincare, you don't just want to put it on your face, you want to take it on your neck and chest too. And that's because if you're putting all these, great serums and treatments on your face, but you're not treating your neck and décolleté, then when you get older, you're going to look like a floating head, because this skin is going to be a lot more aged and then your face is not going to be. And so it's just going to look really odd. So just try to take it all the way down to your neck and chest. The only thing I would say about this is the skin on your neck can be a little bit more sensitive. So if you're using like a tretinoin or a glycolic acid and the skin on your neck is getting really irritated, then maybe skip that or just do it less frequently than you are your face. Also, when you're putting on your skincare, you want to be really gentle. I see people all the time when they're doing their skincare or makeup, they're being so rough on their face and pulling and tugging their skin. And same with like sleeping on your side. Over time, that's going to break down that collagen and elastin, and that's going to lead to premature aging. And so you're kind of being counterproductive when you're applying these anti-aging creams, but you're being really rough about it. So try to be gentle, use upward motions, things like that. And then something else you can do is to take collagen like orally, like a supplement. So I like the collagen powders. There's different forms of collagen, and I'll link some studies below that you can look into. But Dr. V's collagen, she uses a marine collagen. I think hers is really good. She also puts vitamin C and hyaluronic acid in it, so you get those extra benefits. And then there's also the Vital Protein ones that you can... Sorry, my dog's looking at himself in the mirror and I think he's freaked out. But there's also the Vital Protein ones that you can get at somewhere like Target, and those are pretty good too. Okay, so now let's talk about ingredients that you want to avoid in your skincare. So these are going to be the same as every other skincare video I've made. You want to avoid alcohol, not all types of alcohol, but if the label just says straight alcohol or denatured alcohol, that's going to dry your skin and lead to free radicals, and free radicals is what damages your collagen and leads to premature aging. So I would just avoid these. Also essential oils or fragrance, because they're really irritating to the skin, and if your skin's irritated and inflamed, it's not in a healing environment where it can replenish all of the good things that you need in your skin. And then also you want to avoid harsh sulfates, because you don't want to strip the skin of its natural moisture. You're already kind of lacking a lot of those natural moisturizing factors. So instead of stripping the skin, you really want to use gentle cleansers and gentle toners and things that are going to help hydrate the skin instead of stripping away those natural oils. So ingredients you want to look for. The number one gold standard is a retinoid. So these are going to be things like tretinoin, retin-A, retinols, retinol, anything like that is in the family of retinoids, and these have so many studies behind them. There's been so much clinical research done on this ingredient, and it is fantastic for a lot of different things, but especially anti-aging. So it helps stimulate collagen and elastin production. It helps increase your cell turnover, so it helps shed those dead skin cells and bring fresh, new, plump skin cells to the top. So it helps with the look of fine lines and wrinkles. It helps texture. It's good for pigmentation and dark spots. So it has a ton of different benefits. It can also help with acne if you get adult acne. Another one is antioxidants. The most famous one is vitamin C, but there's a ton of different antioxidants on the market. Antioxidants are going to help get rid of the free radicals in your skin that can be caused from pollution, UV damage, using products with alcohol in it, a bunch of different things. So antioxidants are really great to help preserve the collagen in your skin. Another good one is niacinamide. This one has loads and loads of benefits, but it's good for anti-aging, it's good for hydration, it's also an antioxidant, and it can also help with dark spots. So that's one that I would definitely try to incorporate into your skincare routine. And what's really awesome is that a lot of brands are putting niacinamide into a ton of their products. It's not an uncommon ingredient, so it's easy to find. Another one to look for is peptides and amino acids. So these are what make up a protein, and collagen is a protein. So you really, really need these in your skincare routine. They're also good to keep the skin supple and soft. Another one that I think is really interesting is growth factors and stem cells. So this one I should probably do a whole separate video on, because there's a lot of science to it. But in short, these are things that your skin can use to help create things like collagen and elastin. And so they're supposed to be really good for anti-aging. They help with fine lines and wrinkles. And I am going to mention some serums and things that have growth factors in them later on in the video. Another one is, of course, humectants. These help hold water into the skin. So these are things like hyaluronic acid or glycerin. Another one you want to look for is emollients. These are things that are going to keep the skin soft and moisturized. I also really like AHAs for an anti-aging routine. So the two I'm going to be talking about are glycolic acid and lactic acid. Glycolic acid is a really, really small molecule, so it can go deeper into the skin and stimulate that collagen production. This can be irritating to some people though, so if you're prone to irritation or hyperpigmentation, or your skin is really sensitive, you might want to be a little bit careful when using glycolic acid. So another good one is lactic acid, and this one is derived from milk. It's hydrating, but it's also anti-aging, and it's a lot more gentle because it is a larger molecule. And then if you are somebody who struggles with sunspots, age spots, pigmentation, you can incorporate tyrosinase inhibitors. So tyrosinase is involved in that melanin production pathway in your skin. So tyrosinase inhibitors are going to inhibit the overproduction of melanin, which is what causes those sunspots and age spots. So these are things like alpha-arbutin, turmeric, vitamin C, tranexamic acid, the list goes on and on. But I'm also going to mention some of those in my product recommendations just in case you're interested. Okay, now let's talk about your AM skincare routine. So I have all of my products with their ingredients lists pulled up in front of me. So we're going to start with a cleanser. Like I said in my dry skin video, you don't necessarily have to cleanse your skin in the morning if you don't have any actives on from the night before. Actives being things like exfoliants or retinoids or something like that. You really don't have to clean your skin. It's totally up to you and what your skin prefers. But if you do, you want to use a gentle cleanser that's not going to strip your skin of its natural oils. So the first one that I've mentioned 100 times on my channel is the Vanicream Gentle Facial Cleanser for Sensitive Skin. This one is super gentle, like the name says. It doesn't have anything fancy in it, but it's going to give your skin a good cleanse without stripping it. Another one is the paula'schoice Resist Anti-Aging Hydrating Cleanser. So this one's like a creamy, gentle hydrating cleanser. I really like it. Not going to strip the skin. Another one is the Stratea. I still don't know how to say the name of that brand, but I think it's Stratea Velvet Cleansing Milk. So this one's another like milky consistency cleanser. It's not going to strip the skin. Super hydrating. Has some glycerin, some rice bran oil, allantoin, which is anti-inflammatory, aloe. Really good cleanser. Highly recommend. Now let's talk about serums. I have quite a lot of serums to choose from here. And you can just use one of these, you can use multiple of these, however you want to do it. But I just wanted to lay it all out there for all of your skincare concerns. Okay, so the first serum is just a hydrating serum. I also talked about this one in my dry skin video. But this is the Dermatology Hydration Booster 10X. So this one has glycerin as the second ingredient, sodium hyaluronate, which is a form of hyaluronic acid, which is a humectant. It also has a few different ceramides and peptides, which are good for collagen production. And then it also has some antioxidants along with aloe juice, which is anti-inflammatory and a humectant. And I have a code for, I think it's like 10 or 15% off of your dermatology order. I'll have it linked down below in case you want to shop a little bit and save some money. I do make commission off of that code, just so you're aware. The next one is the Naturium Multipeptide Advanced Serum. I really like Naturium. They have such good products and they're pretty affordable. You can find them at Target. But this one has a blend of different peptides. It also has encapsulated copper peptides and argireline, which argireline has been called like Botox in the bottle because it can have the same smoothing effects that Botox can. But the big concern with that one is whether it was able to actually make it down into the skin to actually do what it needs to do. So the fact that it's encapsulated means that it can penetrate deeper into the skin and be more effective, hopefully. This one also contains squalane, which is a really great emollient. It has shea butter, sunflower extract, mannitol, which is a humectant, ferulic acid, which is a great antioxidant, and it's antimicrobial. oil. So this one is fantastic for hydration and anti-aging. Another one that I've mentioned a bunch of times and that is super viral is the CosRx Advanced Snail 96 Power Essence. So the snail mucin is a wonderful humectant to help hold water into the skin and keep it hydrated. It's also been shown to have some antioxidant benefits, so it can help with anti-aging. And then this product also has panthenol, which is anti-inflammatory. It has arginine, allantoin, and then of course sodium hyaluronate, which is hyaluronic acid. So this next one I went back and forth on whether I wanted to mention it because it is so crazy expensive, but this is a skincare product that does have some research behind it, and I don't know that there's anything quite like it, at least that I've found. If you know of anything similar, please let me know in the comments. But this is the Skin Medica TNS Advanced Plus Serum. So this is a serum that contains human fibroblasts, which fibroblasts are the cells that produce collagen. So this is a growth factor serum. It's supposed to help with diminishing fine lines and wrinkles. It also has glycerin, shea butter, some hydrating ingredients, and a probiotic. So this is a crazy expensive serum, but if you're super serious about skincare and you feel like it's worth it to you to spend the money on it. The next one is a brand that I've more recently discovered, and they have a ton of products that I really like. So this is the Medicate Liquid Peptides. This is a super hydrating serum, and then it also has a peptide complex for anti-aging. It contains glycerin, a ton of different peptides, sodium hyaluronate, inulin. It has a lactic acid and glycolic acid copolymer, so that's both of those AHAs that I talked about earlier. So that's great for anti-aging. It also has panthenol, which is anti-inflammatory, and it's a great humectant. Because this has the lactic and glycolic acid, I would probably only use this one at nighttime just to be safe, but all the other ones that I talked about previously, you can do morning or night. The next one is the DRMTLGY Needleless Serum. I absolutely love this serum. It is packed with peptides. It also has ceramides and niacinamide. It has cholesterol, which is a good emollient. It has some antioxidants. So this is a fantastic serum. You can use it morning or night. And like I said, I have that discount code down below if you want to save some money. If you would like to use a vitamin C serum, there's the SkinCeuticals CE Ferulic, which is super expensive. If you want to use it, go for it. But a good dupe for that one is the Timeless 20% Vitamin C plus E and Ferulic Acid Serum. So this one contains L-ascorbic acid, which is the vitamin C, and then it also has ferulic acid, which I mentioned earlier is a good antioxidant and antimicrobial, so great for acne. But the ferulic acid helps to stabilize the vitamin C because vitamin C is really hard to formulate with. It's not very stable. So the ferulic acid helps with that. This one also has sodium hyaluronate in it and alpha tocopherol, which is an antioxidant, and then it contains panthenol, which is anti-inflammatory and a good humectant. And vitamin C, there's a lot of debate on whether it should be used day or night. I say use it either way. I wouldn't use it both morning and night, especially because this one's a 20%. It could be kind of sensitizing to the skin. It has a lower pH, so it's more acidic. So it can irritate your skin if you overdo it or if you use it with other irritating ingredients. So I would pick either morning or night and stick to that. Okay, now let's talk about moisturizers. So the first one is a good daytime moisturizer. This one is the Ordinary Natural Moisturizing Factors plus beta-glucan. So like the name says, it has a lot of those natural moisturizing factors in it that our skin is supposed to naturally produce. And then beta-glucan can help calm the skin and also hydrate the skin. This one's packed with a bunch of different amino acids. And then it also has the sodium PCA, urea, allantoin, sodium hyaluronate, phospholipids, and then tocopherol, which is an antioxidant. So this one is a really good moisturizer, but it is more lightweight, so it's good to wear like under makeup if you want to do that. But this one isn't like a thick cream, so for me I don't think it would be heavy enough for like a nighttime cream. but you can try it out and see what you think. The next one I would say to use more at nighttime. So this one is the paula'schoice Clinical Ceramide Enriched Firming Moisturizer. The reason I say to use this one at nighttime is because it has retinol in it. You could use retinol during the day and just make sure that you apply SPF, but I would say just to stay on the safe side, I would use this one as a nighttime moisturizer. But this one, like the name says, has ceramides in it. It also has a form of vitamin C, which is an antioxidant. It also has some emollients in there, a blend of different ceramides, some different oils and extracts, and vitamin E. So this one is a really good kind of all-in-one moisturizer if you're looking for that to kind of help simplify your routine. Another one that I want to talk about is the DRMTLGY Peptide Night Cream. So this one is packed with a bunch of peptides and ceramides. It also has glycerin, which is a humectant. It has dimethicone, which is a really good emollient, tocopherol, which is vitamin E, allantoin, which is anti-inflammatory, cholesterol. I will say if you're somebody who is acne prone, this one does have isopropyl palmitate as the sixth ingredient. 6th ingredient, and that is a 3 to 4 on the comedogenic scale, so it could clog your pores. So just be wary of that. But everyone's skin is different. You never really know how your skin's going to do with an ingredient. So I wouldn't write it off just because of that. But just be aware. Other than that, this one is a great moisturizer. The next one is the paula'schoice Omega Plus Complex Moisturizer. This one has shea butter as the second ingredient. So it's going to be a really emollient moisturizer. It also has glycerin, a few different oils, linoleic acid, some ceramides, some amino acids, squalane, cholesterol, lecithin. I could go on and on, but this one is really packed with a lot of good emollients and moisturizing ingredients. So I think this one's a really good option if you are super dry or you're, of course, concerned with anti-aging. And then for sunscreens, I'm going to recommend pretty much the same ones that I did in the dry skin. Sorry, my dog just came in here. This is the noisiest dog, I swear. But I'm going to recommend the same SPFs that I did in my dry skin video. So the Naturium Dew Glow, if you want that super dewy finish. It's a chemical sunscreen. I also like Isentree's Watery Hyaluronic Acid Sun Gel. That one's super hydrating but not greasy. It's also a chemical sunscreen. If you want a good mineral sunscreen, I like the dr.v Inzincable. And then if you want a tinted sunscreen, I like the Dermatology, I think it's called the Physical SPF or Universally something SPF. I'll have it linked down below, but all of those are really good options. So then for the nighttime, if you've been wearing your sunscreen throughout the day or you have makeup on, I'm going to recommend that you do a double cleanse with either an oil or a balm cleanser first, and then follow it with your regular gentle cleanser. So the first one is the one that I've been using and loving. It's the Inkey List Oat Cleansing Balm. This one has sweet almond oil, cetyl alcohol, oat kernel flour, lecithin, ascorbyl palmitate, which is an antioxidant, and tocopherol, also an antioxidant, and then sunflower seed oil. This one does a really good job of breaking down and removing your makeup or sunscreen. Another one that I've talked about before is the Face Theory Deeply Nourishing Jojoba Cleansing Oil. This one has a super simple ingredients list. It has jojoba seed oil, argan oil, rosehip oil, cranberry seed oil, lecithin, vitamin E, and that's pretty much it. So this one's going to help hydrate and break down the makeup and skincare again. Another one that I like is the Bioma Milky Oil Face Cleanser. It has olive fruit oil. It also has rosemary leaf oil, which could potentially be irritating, so just be aware of that. But it also has some kind of fruit oil, tocopherol, ceramide MP, squalane, and moringa seed oil. And then you can follow it up with any of those cleansers that I mentioned earlier in the video. So then at nighttime, this is when you want to break out your actives. So if you're somebody who struggles with sunspots, age spots, melasma, any kind of hyperpigmentation, a product that I really like is the Topicals Faded Brightening and Clearing Serum. So this one you can find at Target or you can order it online. But this one is packed with those tyrosinase inhibitors that I was talking about earlier. So it's going to help a lot with the overproduction of melanin in your skin that leads to those dark spots. As the third ingredient, this one has glycerin. Then it has niacinamide, tranexamic acid, shea butter, jojoba seed oil, alpha-arbutin, which I absolutely love. It has kojic acid, turmeric, azelaic acid, melatonin, phytic acid, squalane, allantoin, Centella asiatica, tocopherol, arginine, lecithin. Like, the list goes on and on, but it really is just packed with those tyrosinase inhibitors, which is really what you need if you're somebody who's prone to hyperpigmentation or you have melasma. Really just using like one tyrosinase inhibitor isn't going to do it. 9 times out of 10 you need to be using a combination. So I really love this product. If you haven't given it a shot yet, I would definitely try that. Then let's talk retinoids. So of course you can use retinoin. I combined Retin-A and tretinoin, but of course you can use tretinoin or Retin-A, which are both prescription retinoids. So that is retinoic acid. These are going to be the strongest, and they're also going to be more irritating than the other ones I'm going to talk about. I am currently using a tretinoin prescription from Apostrophe, which is an online skincare service. This video isn't sponsored or anything by them. I wish it was. But it is an online dermatology service where you upload pictures of your skin, tell them your skin concerns, and then they give you a custom prescription bottle that they just send to your house every few months. So that's a good option if you're wanting to start tretinoin. You can also use a retinol serum, which is a step down from retinoic acid. Your skin has to go through a step to convert it to its usable form, but that makes it a little bit more gentle on your skin, and some studies have shown that it's just as effective as tretinoin. So one that I like is the Geek and Gorgeous A-Game. They have an A-Game 5 and an A-Game 10, which are just different strengths, so I have both of those linked down below. Another product that is really expensive that I hesitated to mention, but if you're somebody who doesn't want to buy a ton of products and use a ton of products and you want something that's all grouped together, this is the Skin Better Science Alpha Ret Overnight Cream. So this one uses a combination of a retinoid with a lactic acid, which is an alpha hydroxy acid, and then it also has glycolic acid, which is the other alpha hydroxy acid that I mentioned earlier. So this one has everything in one. So it's going to be really great for anti-aging, pigmentation, collagen production, all the things. It can be irritating on your skin, of course, so I would not use it with any other actives in your skincare routine. Same with any other retinoid. I would use this one on its own and then start out only using it a few nights a week and then work your way up from there. It is a really interesting product, and I know a lot of people have seen really amazing results from it, so if you think it's worth it to you, give it a shot. Next is the paula'schoice Resist Advanced Smoothing Treatment 10% AHA. So this one is a 10% glycolic acid. So this one has the glycolic acid, of course. It has lactic acid, malic acid, tartaric acid, different peptides and ceramides. It also has salicylic acid, which is going to be good if you're somebody who is prone to clogged pores or acne. It has licorice root extract, which can be brightening to the skin. It has green tea in it, which is an antioxidant and helps calm. Oat bran extract, list goes on and on. But this one is a really good exfoliating product. I wouldn't use this one with a retinoid or other exfoliating product, and I wouldn't use it every night. This is something that you want to use like once or twice a week. Same with this next one. This is the Naturium Glycolic Acid Resurfacing Gel 10%. I think they also have an 8% glycolic acid, but this one has, of course, glycolic acid. It has some fruit extracts, sodium hyaluronate, and then a few antioxidants. So I like this one for a glycolic. Another one from Naturium is the Vegan Lactic Acid Emulsion 5%. I would say that a lot of people would be able to use this one on a daily basis because lactic acid is more gentle, but this one has sunflower seed oil, the lactic acid. It has antioxidants, niacinamide, aloe juice, bisabolol, which is anti-inflammatory, and then it has some other hydrating emollient ingredients. And then you're going to want to put your moisturizer on top of that, which you can use any of the ones I talked about earlier. And then I've never talked about eye creams on my channel before because I don't think that they're 100% necessary. But if you have specific concerns around your eyes that you want to target that you don't necessarily have for the rest of your face, then I think eye creams are a good option. So one that I really love is the Skincare by Dr. V Triple Action Eye Cream. This one is going to help with fine lines and wrinkles around the eyes. It's also going to help with dark circles, pigmentation, and then it can also decrease the puffiness that you get if you eat too much sodium, you've been crying, you didn't sleep well, whatever. So this one is packed with a ton of goodies. So just to mention a few, we have glycerin, jojoba oil, niacinamide, tetrahexyl decylascorbate, which is a really good lipid-soluble form of vitamin C. It also has tranexamic acid, which is a really good brightening agent. It has caffeine to help depuff, alpha-arbutin, which is great for pigmentation. This one has some ceramides and peptides in it for anti-aging and wrinkles. It also has retinol and retinol, so 2 forms of retinoids. It has tocopherol acetate, retinol palmitate, ascorbic acid, and the list goes on and on and on. So this one is a fantastic eye cream, especially if you have fine lines or dark circles. Okay, I'm back. I had to take a short break because I was literally like losing my voice. My throat was getting so dry. But I ate some baby carrots, drank some Prime, and we're back and better. So I think I left off at eye creams. So after you apply all your serums, your moisturizer, if your skin is feeling a little bit dry or damaged and you really want to lock in that moisture, if you're not using a retinoid or an exfoliating product that night, then you could go in with a petrolatum based product on top. So this can be either Vaseline, Aquaphor, CeraVe healing ointment. You can pick your poison on that, but this is going to really lock in that hydration and prevent transepidermal water loss or TOL, and that is just where the water from your skin evaporates into the air and leaves your skin dry and dehydrated. So if you put on a hydrating serum, a moisturizer, and then that petrolatum based product on top, and then you sleep with a humidifier at night, you're going to wake up with super plump, juicy, hydrated skin. But I wouldn't do this over top of a retinoid or an acid or any kind of irritating ingredient, because I wish you guys could see this dog right now. But yeah, don't use this over any irritating, over any irritating ingredients, because it can make them more irritating, especially with a retinoid or a glycolic acid. So I think that is everything I had to talk about. I do just want to say that I don't want this video to come off like I think that signs of aging are necessarily a bad thing. I think that wrinkles can show that you've lived a full life, you've smiled a lot, you've been expressive, and so I think that signs of aging can be beautiful, but it's really all about just being confident in your skin. So if having wrinkles or age spots or things like that make you less confident and be less comfortable in your own skin, then I just want to give you guys all the tools that I can to help treat those things and to make you feel more comfortable and more confident. So that's really what this entire channel is about and what all of my videos are about. I never want to come off like I'm pushing you to go get filler or to buy all these expensive products. It's really just about giving you guys the education and the tools and the recommendations to help you guys feel more confident and treat your skin concerns. So I hope this video was helpful. If you have any comments or questions, you can just leave them in the comments down below. I'll have everything linked. I'll put the studies down there too if you want to check those out. And other than that, I hope you guys have a great rest of your day or night, and I will see you guys in the next video.